How's it going, guys? We have a pass level question for Repro. 31-year-old woman, she has polycystic ovarian syndrome, which is going to be the combination of anovulation plus hirsutism. Let me explain. When you have a high BMI female, that causes insulin resistance, which leads to abnormal GnRH pulsation. This causes an increased LH to FSH ratio. LH is high, FSH is low as independent arrows as well. What does LH do? It stimulates the theca interna cells in females to make androgens. Well, if LH is high, then androgen production will be high, so that's why we get hirsutism. FSH, what does that do? Well, follicle stimulating hormone. So if FSH is low, you're not going to get follicular stimulation the way you're supposed to. So the follicles during the normal follicular / proliferative phase of the menstrual cycle, rather than maturing adequately and getting Graafian follicles that rupture, we don't have that, and we have retained cysts. This occurs over many cycles. We get many cysts accumulating. That's why it's called polycystic ovarian syndrome. Now, this process that I just described with insulin resistance, high BMI female causing failure of ovulation, that's called anovulation. Okay, so you'll frequently hear that term used interchangeably with PCOS. It's the same thing. And if you just add hirsutism on top of it, it's now the syndrome of PCOS. Okay, now any female who has an elevated BMI, who has oligomenorrhea, maybe a period every 2 months, every 3 months, that's anovulation until proven otherwise. Now, in real life, PCOS doesn't have to occur in high BMI females. It can sometimes occur in normal BMI women. But for USMLE, it's going to be high BMI as per the mechanism I just described. So the Graafian follicle, when it normally ruptures at ovulation, that follicular remnant is called a corpus luteum. The corpus luteum normally secretes progesterone. Progesterone limits the growth of endometrium. Estrogen stimulates the growth of endometrium. So if we have estrogen without progesterone, because we're not ovulating and making a corpus luteum in the setting of PCOS, then we have what's called unopposed estrogen, where we get too much endometrial stimulation, where the progesterone can't put a check on it. This causes endometrial hyperplasia. Choice C, correct answer, endometrial simple columnar cell number. Hyperplasia, increased cell number, and endometrium is predominantly simple columnar. Endometrial hyperplasia increases the risk of endometrial cancer later in life. So for TCK step 3, they can give you simply a 58-year-old woman who's postmenopausal and she's high BMI and she has endometrial, or she has bleeding per vaginum, and the answer is going to be endometrial biopsy. And student says, well, how do you know that that's endometrial cancer? Well, bleeding per vaginum in a postmenopausal woman, the red flag being you need to rule it out, but also if she's high BMI postmenopausal, she was likely high BMI throughout most of her life, and that increased the risk of anovulation when she was premenopausal, causing endometrial hyperplasia, which led to her current endometrial cancer. You understand? So this mechanism, exceedingly high yield for steps 1, 2, 3. Let's just chop out the other answers real quick. Choice A is wrong, because if we have endometrial hyperplasia, not only would we have increased cell number, but you can infer that there'd be glandular stimulation from the unopposed estrogen. So choice A, wrong fucking answer. Choice B, diminution, fancy word for reduction. Diminution of serum luteinizing hormones, wrong, because as we just inculcated, LH is high, not low in the setting of PCOS. Wrong fucking answer. Choice D, increased luteal progesterone, is wrong, because as I just discussed, when you don't have a ruptured Graafian follicle and you're not making a corpus luteum, then you're not going to be able to produce progesterone. So a similar answer, they can just give you a vignette of PCOS and say, which of the following is most likely to be seen in this patient? And the answer can be decreased luteal progesterone. The luteal phase, the secretory phase, second half of the menstrual cycle. Wrong fucking answer. Choice C, increased rate of Graafian follicular rupture, is wrong, because as I just harped on, the whole process of having anovulation entails that rather than having rupture of the Graafian follicles, they're going to be retained as cysts over many cycles, hence polycystic ovarian syndrome. Wrong fucking answer.